Hi, here are your post-operative instructions. Number 1, you have to bite firmly on the gauze that was placed. It is critical that you bite firmly for the next 30 minutes. That's the best way to stop the bleeding. 30 minutes later, you just have to simply gently remove it. Now, if it's still bleeding, all you have to do is get a piece of cotton ball, dampen with water, bite again for how long? 30 minutes. Which means you keep on doing that every after 30 minutes for as long as it's bleeding. If at any point the bleeding stops already, there's no need for you to bite on a cotton. The next thing you have to remember is to avoid vigorous gargling, constant spitting, and using a straw, all of which would just promote more bleeding because it's disturbing the clot. You may still gargle, but you have to really do it gently, and instead of using a straw, when you drink, you just drink straight from the glass. Try not to sleep on the same side where the surgery was done. How will you remind yourself? Put a pillow on the side where the surgery was done so that you avoid turning on that same side. It is normal to have some form of post-operative discomfort, but don't worry, the prescription would take care of it. So make sure you take the medicines on time as instructed, especially the pain reliever. Don't delay it. The sooner you take it, the better. Also, equally important are your antibiotics. If you are prescribed with antibiotics, please take them. Now, regarding your diet, you're not supposed to eat anything that's hot. No hot food or drink for today. Instead, you're only allowed to eat anything that's cold or room temperature, specifically soft, like ice cream, yogurt, congee, noodles, oatmeal, soup. Allowed to cool down at room temperature before eating. The diet restriction is only for today, meaning by tomorrow, you could gradually go back to your regular meal. How do you maintain oral hygiene? Well, for today, no brushing. It is not recommended for today. What can you simply do? Gentle rinsing of tap water is the only thing you could do for today. Tomorrow, you could go back to your routine brushing. And aside from brushing, you could use a natural mouth rinse. What is that? Get 1 glass of lukewarm water, mix half teaspoon of salt, and every after eating, that would be the solution you're supposed to rinse on the surgical site to avoid accumulation of food. Don't forget that it is normal to swell. The more you would see that same swelling on the 2nd or 3rd day post-op. So, what can we do with your swelling? There are 2 main ways. Number 1, your analgesic or your pain reliever would help control the swelling. The second way to control it is by following the sequence of compressions. Starting with cold. Cold will be done in the first 12 hours. So just keep on placing your cold compress on the surgical site, and if it's too cold, remove and replace after a few minutes. On the 3rd day, you start to shift to warm. Same surgical site, same area where you place it, but again, from the 3rd day onwards, you just continue applying it. When will you stop if the swelling is gone? Strictly, there should be no strenuous activities for the next 24 hours. Bruising could also be seen on the surgical site, which is normal. Don't worry about it. It just simply fades on the next 7 to 14 days. It is also common to have some form of difficulty in opening your mouth. Again, just follow all the instructions, specifically the compressions, and it will improve your mouth opening for the next 5 to 10 days. Then, a week later, approximately 7 days, you have to come back to the clinic so the sutures would be removed. Stitches were placed, so it has to be removed after 1 week. Here are the following reasons why you should immediately call the office. Number 1, it's painful. What is the common cause for pain? Delayed intake of the pain reliever. So take your pain reliever, or else you're gonna remember me later. The second reason for calling the office, you're still bleeding. What's the common reason or cause for it? You failed to bite firmly on the gauze. Remember, that's the most important thing. It's gonna control your bleeding, so please bite firmly for the critical 30 minutes. Other reasons for calling me? Probably you still have a swelling after the 5th day, you have fever or any other symptoms, or you want to ask some more questions regarding your post-operative instructions. All of these instructions would be easy to remember. Why? Because I'm going to give you a copy of which. If you want, you could scan the QR code, which is printed also in the post-operative instruction, and you will be channeled to a digital copy of the instruction itself. Now, if you still want to clarify any of those instructions given to you, simply ask Dr. Brillo. He's more than willing to answer your questions. Thank you.